Okay, off we go. So, yeah, welcome to everyone, and thanks for joining the launch webinar. I am Daryl Froke, probably to call myself the movement architect. Basically, I'll go through who I am, a little bit about what I do, and then I'll hand over to Amanda to do the same. And then we'll be asking some questions about what we've been brewing in our pots for the last, I don't know, 6 or 7 months. It's been very exciting. So, basically, I'm from South Africa. I was a budding young sportsman who ended up with some quite bad chronic injuries. Had to give up on that dream, and in the process, had to stop sports, full stop. I even had one of the best physiotherapists you could get, chiropractic doctors. Every time I pushed myself to perform at a high level, things would go wrong in my back and spine and growth disorders and all that kind of stuff. So I eventually gave up on being a professional sportsman and went overseas to the UK and had some fun and ended up randomly meeting people who helped me with my posture and things that were possibly holding me back, no matter who treated me. So yeah, I ended up randomly studying things that helped me get better and help myself get better. Yeah, and that's basically how I got into my career. Obviously frustrated that I couldn't do what I wanted to do, with pain, etc. And then randomly ended up getting into other things, which led me to personal training, which led me back to postural alignment therapy. And so now I'm sort of in the more therapeutic movement space or longevity movement space. What I look at in my clients' bodies is, first of all, structure. So we have a human blueprint. If you're out of alignment, and we're talking about 8 loading joints and right angles, it's all quite organized. If we have any asymmetries or misalignments, it can cause our movements to become less good for us, basically, causing wear and tear. So we try and do some adjusting with stretching and little local exercises to correct the structure, basically. So pelvic exercises, thoracic spine exercises, foot and knee, ankle, that kind of stuff. And once you've got a bit of improvement, and also if the person's symptomatic and you get rid of some of those symptoms, you start moving into the dynamic exercise, which is where I look at the fundamental movement patterns of the body, which are the only 8 things your body can do. And if you can train those with better symmetry, better alignment, and teach that person how to move better with less imbalance, it not only takes away the injuries and allows, in fact, takes away barriers to self-healing, it allows them to go through that dysfunctional state to become more functional in the things that they do day to day. So posture, alignment, compensations, all that kind of stuff. And I'm truly passionate about it. I've not studied one thing. I've gone and studied lots of little things, and I've sort of built my own little technique in the years. And it's been tried and tested with all of my clients for the last probably more than 10 years, even though I've been coaching people exercise for 25 years or so. So yeah, why are people feeling stuck, sore, less confident, even though they're all trying hard? So that is what I kind of focus on. That's probably enough about myself. So let's ask Amanda before we get on to our big topic. Could you please introduce yourself and explain what you bring to my mobility code from the biological side?
Yeah, absolutely. And I do actually want to talk a little bit about why we even met, Daryl. I think that that's useful background. And so we have a common colleague, also South African, Celine Morin, who was in the UK, still working in the UK, but now in France, because that's actually her origin. That's actually where she's from, her parents. So long story short, she introduced us because we were all working on something called C-Suite, which was an executive focus program in the UK that Celine was really marketing. And what we were bringing to executive teams was the opportunity for them to explore how they're built, so their biological architecture through the lens of their DNA. And through the reports we were running, I was able, of course, to see my work, which I'll explain, which is basically their architectural landscape, how a human being is built, where the blockages are, where the efficiencies are in their physiology or the biochemistry. And of course, a big part of that is movement, which is where Daryl came in. So there was Celine, myself, and Daryl. And Celine was really operating as the go-between, right, Daryl? She was the glue. She was a health coach. I did the biological science side, and Daryl did the movement architecture. And then from that, we also, three of us worked on a big program with a client in California where we built something called fundamental fitness. So our client was actually very interesting to the topic of today. They were a company that operated independent living facilities, if you will, across the United States, where people, most of the average age was over 75. Mobile, cognitively able adults who wanted a little bit of structure. They didn't want to live by themselves. They did, but they didn't, right? So they had a community, and part of that work was building a fundamental movement program, because mobility is connected to everything. It's connected to independence. So that's where huge work we did actually with Daniel, who's with us, and Daryl and Claire too. So that's the work that Daryl and I have done together. But how we came together with my mobility code is because my expertise and my background is in genetics. So again, like I said, I unwrap the architecture of how a human is built. Literally, and we've been able to do that for a long time. But when I'm doing that, literally, I'm able to look at a human being through the lens of where the efficiencies are in their systems, heart, lung, liver, if you will. That's more epigenetics. But importantly, is the way they're built going to impact things like collagen and joint synthesis? Are they going to have an issue with inflammation? Are they somebody that may potentially have more cardiovascular challenges simply because of the genes that they've inherited? And if we see that, we know what we can do about it. So I see the architecture, and I can turn things on and off. I can optimize systems, optimize a lot of things, kind of like turning up and down dials in a system is what we can do through really genomics and genetics. And that's as a part of that, and we'll get into our work now, Daryl. What I kept finding is I could turn about 80% of the knobs, if you will, or the dials. But when somebody is stuck in movement, it changes their outlook on life for so many reasons. And so about 80% of my clients, I kept saying, I think you need to see Daryl. You need to see Daryl. You need to see Daryl. And so we said, Daryl, we need to do something about me sending people to Daryl because the movement piece became so important. So that is my work. I'm the biological architect. Okay, back to you, Daryl.
Well, and I suppose why, we're talking about why we created the My Mobility Code system is, we were both seeing people that were very active, committed, doing all the right things, but still struggling with fatigue and pain and inflammation, poor recovery and all that kind of stuff. So, maybe you could say from your side, what made you feel DNA and biology needed to be part of the movement recovery and longevity conversation?
Yeah, or really, to me, it was like the other way around. So let's give an example of the why. So my general client, and I think we've talked about this a lot, Daryl, we can see people across the life spectrum, but where things start to show up a lot is in midlife. And midlife can be like 35, 45, 55. And what I kept seeing, and why mobility is so important, is with my clientele, a number of things kept happening. I would see people who've been athletic all their lives, or during their college or university years, they were active competitors, not pro athletes. And they loved to run, or they loved to cycle, or they loved to ski. And when they came to me, that wasn't the reason they were coming to me. They were coming to me for some other issue, maybe hormone, maybe sleep, maybe mood, maybe whatever, inflammation. But when I would ask them about movement, they would say, well, I just stopped doing that. I'm like, well, why? Well, I kept getting re-injured. And I kept, I worked with physical therapists or trainers or whatever. And I could see it in them that they put movement on the shelf. They would still walk or whatever, but they felt that light in their life had been taken away from them. And I said,
Yeah.
oh, no. Because what happens when you do that, and so I've got a number of scenarios, Daryl, that's one of them. And maybe we can talk about 3 different ones, because I think it's a really good foundation, for us to talk about how we work together. But this is a classic client, the re-injured, I've given up on doing what I loved because I can't get to well. And what happens is that's on a shelf, and psychologically the person in front of me has changed. That there's a light that is dimmed because they don't feel they can get away from the pain or have that mobility back. And I'm like, oh, yes, you can. So I then send that client over to you, Daryl, and that's like a perfect scenario.
Yeah. And I mean, it's first of all, just for everyone to know that from what I've learned in the years of training slightly older people, or people that are aging, or people that are injured, and et cetera, fear becomes one of the biggest movement drivers. So they know what they should be able to do, but their body has this pain memory, and they're struggling to do it. I mean, I've had people who've come off toxic treatments for extreme diseases, which has affected their body's ability to grow and strengthen. And they've trained with me frustratingly and relentlessly for a year or more, and not really got good results. But I didn't have the information that Amanda could give us about, recovery and collagen production and inflammation, even the type of muscle fibers that their body is, rich with, and therefore the type of exercise would suit them better. So to have that kind of information is to almost like being able to see inside while observing outside, and it's sort of like a secret weapon. Function is actually mobility and stability and endurance, but also in your day-to-day movement patterns. And a lot of people that I've got from Amanda and other sources, and probably most from Amanda, are trying really hard. I've even got someone at the moment who's been seeing different types of exercise coaches and therapists and physios, and all, no one's did anything wrong, but she's not been able to get herself better into a state where she's able to walk well. So she's gained weight and all that kind of stuff. So since you've been, and Shannon have been looking after her, she's actually losing. She's got increased bone density. And since I've been just showing her natural movement, she now doesn't need her husband to help her walk to the house from the car. And it's been about 7 weeks after 25 years. So it's like there's these missing pictures that, even though these people are trying so hard and putting so much effort in, they're just not getting it quite right. So yeah, this is where my spine starts to tingle with excitement, because it's like having all the toys and the combined knowledge and experience to put into this particular thing, which is where my mobility code comes from. I
think in that case too, Daryl, just with that client, and there were so many beautiful cases here, you highlighted something we see a lot, that with a lot of our patients, or clients, excuse me, they're not patients, they're clients or individuals, they're afraid of the pain. I've sent a lot of clients over to you. They are, movement equals pain. And so they're afraid to move. And this was a perfect example. And yet genetically, it's not that I can see pain. I can see a pain response. Some people have a much heightened pain response. They're the individuals who need higher levels of pain, anesthesia, or coming out of surgery. They need much higher pain management. A lot of times they're women too. So imagine that. Oh, you're imagining it. No, they're not imagining it. It's super real. We can see that genetically. But with this particular client that I'm thinking of, metabolically, she had some of the best set of genes I've ever seen. I mean, there was no reason at all for her not to be an amazing athlete, which she was. So this was really great news in this particular case, that she was blessed with a very powerful set of genes that made her basically a great all-around athlete. She could be a great triathlete. She had that set of genes because she didn't favor power versus endurance at all. But metabolically, she was primed. So the thing that was holding her back was the movement. It was the fear of moving, because we hadn't, this is where Daryl's so brilliant, we hadn't looked at her from the outside, the structural posture. Where were the imbalances that when you can correct those, the recovery's there, the inflammation goes away, the fear of pain goes away, the psychological blocks come back online. So that's where DNA meets human symmetry, because we can literally see the client knows their potential. They just haven't had the right hands holding them to get to that place where they can blast through those fear walls. So that was a great example, Daryl.
Exactly. So, yeah, I mean, what is the mobility span? I mean, we hear a lot about Healthspan. It was a buzzword. In fact, when we were starting to talk about it, we were going to do a webinar about Healthspan, but then I immigrated. And now Healthspan has become less of a buzzword. So we've sort of created our own one, which is talking about mobility span. What do you think people need to understand about mobility span, Amanda?
Yeah, so I'm gonna let's go back, because we coined this because that is the space we're in, right? So the mobility piece, and notice everyone, what's trending all of a sudden. Mobility, if you watch, you follow exercise on YouTube or whatever. Now everyone's doing mobility, qigong, fascia, and lymphatic drainage. If you haven't noticed, right, Daniel, you've seen it. And it's actually brilliant, because it's actually what the body needs. But I thought it was interesting with mobility. So for me, the mobility piece is actually what's is missing in the quote longevity health span movement, because mobility is directly tied to independence, to lack of pain free, to confidence, and to not be told. So I'll give you a perfect example. Looking at people whose mobility potential has been taken away from them. Imagine someone who's been a skier, they a biker all their lives, and they suddenly are told, well, you need a knee replacement. Like, okay, maybe that's legitimate, right? We don't know. Maybe it's really legitimate that they need that kind of knee replacement. And they're told, well, we'll do a knee replacement, but it will get you from the couch to the kitchen and back. And you're told that as a 75-year-old from a 35-year-old orthopedic surgeon.
Yeah.
That is taking somebody's mobility away and being told, yeah, you can't do what you used to, but we'll get you so you're mobile. And that is a real crusher for people. I think, okay, I've got to hop around for the rest of my life. So, mobility span to me is deeply tied to independence. That's one thing, which is tied to your cognitive well-being, right? And so those two things. But I think there's another side, and I'll hand it back to you, that I'm seeing, and it's often with some of the clients we're working with, Daryl, with osteoporosis. It's not, this is sort of a pandemic. So epidemics, whatever. Yeah, pandemic too. But it's the same, right? It's a huge problem. And these individuals are not taught functional movement, which leads to mobility. They're taught like what I call almost like unilateral strength, right? These are words that I'm just sort of making them up, or one plane loading of their spine, where what they actually need is functional movement, which leads to mobility that will prevent the fractures. So that's a mobility to me, I guess, independence in multiple planes, right, is how I look at it.
Yeah. But I mean, the bones, let's talk about the bones. What they're looking for is they're looking for forces that make them stronger. And you've got 66 joint motions in your body. So how can you go and sit at a place where you pay money and do an exercise that just does one dimension of movement, where you've got 66 different joint movements? When you're walking, which for me is one of the most important things to train, whether you're trying to improve your mobility, your strength, your speed, or your bone density, it's the thing that is most frequently used. And if done correctly, it loads the bones up by moving them in all three dimensions. And they're having to adapt and react and recover from all these sort of areas where they're being moved out of a comfortable position. They're having to be pulled back. So very, very important. And ultimately, it's got to do with getting you not just disease-free or happy and doing well, but actually having a great lifestyle, being able to pick up your grandkids until you're 100, or even try and chase them if they're needing to be, without having to deal with pain and all this kind of stuff. And so that's for me where it comes from. And I mean, that's like the person we call it fit but fractured, which, like you say, is that active person. They're doing the right things, but their body's pushing back and they can't actually get where they used to be. So I suppose Looking biologically, when someone's training, eating well, staying consistent, but still struggling, inflammation, fatigue, all that kind of stuff. Maybe you could comment on that, Amanda.
So the question is, like, looking biologically, what was it?
Someone who's fit but fractured. So someone who's got this great history of sports, but they suddenly are struggling. They've got the best coaches, they're doing all this great stuff, but they're still dealing with all of those symptoms that we just mentioned. How would you look at that biologically?
Yeah, and I think in your case, we've talked about this over the years, over the time I've known you, that from your perspective, your clients, if they're coming to you for mobility and, for structural realignment or whatever, all those brilliant things you do, these clients get to about 80% and they can't get to 100%, right? They kind of hit a wall. And that's where I'm looking biologically or biochemically, saying, what is it that's keeping that door closed? What are the bottlenecks? And I think biological, when I'm looking at genomics, this is the most brilliant part of the science, is so often the answers is what I say is in the dirty, dark corners of our biochemistry, or it's hidden in the numbers when we're running like labs to look at the immune system. It's these subtle little signals that we're seeing that say it's this. And so what we're actually doing from genetics is we're looking for the aperture, we're looking for the opening, we're looking for where that system is only half online. And when we bring that back online, it's like the innate intelligence of the body comes back online too. So we immediately think, oh, it's inflammation or it's oxidative stress. What we're finding so often is it may be in detoxification. The body is carrying so much sludge around, if you will, that causes a lot of stress to the body, that when we open up those systems, the light can shine again. Or in methylation, this sort of the system that's trending globally, but it's probably one of the most complex systems to understand in the body, but it's deeply related to cognition. It's deeply related to energy synthesis, to muscle creatine and muscle synthesis. That when we can find these aberrations, which we'll see genetically and validate it in lab work, when I turn those dials back on, it changes the outlook of the client. It's in front of you, Daryl, and it kind of blasts through that door, but it's not obvious. It's not obvious like to a PT or something like, or an occupational therapist or something, that these are the issues because they're hidden. So when you bring DNA, so that's the architect of how a person's built, together with, which is the internal piece, together with what you're seeing with your brilliant eye, Daryl, that is a match made in heaven for people who are stuck, with mobility or rehab. We blast through those doors. Yeah.
So, also, is the body being asked to do too much so it can recover from? That's a very big thing, because I see people overtrain. I've watched people train 1 to 2 hours, 5-6 days a week, 10 years and never get results.
Exactly.
So are they eating right? Are they getting the right supplementation? And what does their body actually want genetically, training wise, but also how are they loading their body? Are they asymmetrical? Are their movement patterns efficient? So it's kind of trying to create the right can for every person, looking from, like you say, inside and outside, like that. So
I think that you hit on a really important point, because you said the word pattern, and what I do for a living is I look for patterns in the DNA, right? And so I'm looking biochemically at patterns. And when a pattern, and often the patterns are not obvious. That's the brilliant piece of the work. You find the patterns, and like you, once you've seen enough DNA, you kind of know what patterns look like. So I'm looking for internal patterns, and you're looking for something that I think is not being taught, but you're doing it already in your space. In human symmetry, you're looking at the patterns of movement and structure and gait and posture. And when they're off, the body compromises, which causes inflammation and oxidative stress, causes injury, right? And if genetically, which we haven't talked about, somebody may be predisposed to soft tissue injury or has a hard time with recovery, all that does is just fan the flames so that they can't get out of that recovery injury cycle until you correct, you know, how they're built, like externally moving.
I think my main goal for clients is to actually teach them to understand movement and their movement better. You know, it might be someone that's training really hard and, you know, they don't need more discipline. They just need to understand that they've got a slightly weaker leg and weaker in this particular plane of motion. Remember, we look at things three-dimensionally. And the second they activate that, their body just gets more able. So it's sometimes about understanding why the body's not responding, I suppose. And I mean, a common pattern I see all the time in injury and pain is it just returns over and over and over because of that sort of cycle of, you know, you get into pain or you get, you know, whatever. You then go and do what you have to do gently to fix it and you come back. But it's actually been sort of masking the outside, or shall I say, the looking at the symptoms and rather than the cause. And obviously there could be a genetics cause or genomic cause, but definitely a movement cause as well. So Amanda, what could be happening biologically in someone with respect to soft tissue strains, tendonitis, joint flare-ups, or slower tissue repair? What do you see from your eye?
Other than overtraining or not really, or undertraining or not understanding how their body's built, like structurally, your work. Honestly, I always say to a PT I work with, every human every year should have an analysis, you know, a posture, gait, structural analysis, and external analysis, so we can tweak their pelvis, you know, or tweak their balance. I mean, I think it's so important. So I'm a huge advocate of this work and always have been, and actively participate in it. But to answer your question, genetically, we do see, so when I'm looking at genetic reports, it is very common for me to see individuals who obviously self-select to come and see me for whatever reason, but it isn't because they're injured necessarily. But I can see their injury in genes that will give an indication they have a hard time with collagen repair, synthesis or repair, or cartilage and joint rebuilding. So the genes we look at, GDF5 for cartilage and joint, frequently disrupted. So we're talking about high frequency in humans. But the collagen synthesis, particularly like a COL1A1, which is the most dominant collagen protein in the body, if there's disruption to that, my conversation with you, Dal, is going to be a little different, that it may take long for that person to repair that. Or usually I'm saying to someone who has no understanding what this means, when you work with your trainer or when you see Daryl, the focus needs to be on soft tissue synthesis and strengthening. That comes up so often, which of course then goes into the multiplane movement, etc., and balance, which is probably why they ended up where they are to start with. And a lot of these people were very good college, or we call them high school, so pre-college athletes. And they will be the ones who constantly had the strains and the sprains. Like, you know, I just turned my foot on the soccer field, and they just brush it off. But genetically, they're the ones much later say, I'm just re-injured all the time. So there's number one, we can definitely see that potential genetically, which changes the conversation I have with them, which changes the conversation in human movement and symmetry, because they need to change their training for the rest of their life, because it can affect balance, mobility later on. It already is. But the recovery piece is critical. A very high number of humans do not have the genes that allows them to push hard workouts every day, no matter whether they're a pro athlete or they're a timid exerciser. There's a huge difference, one human to the next. I'm one of the ones who cannot push hard every day, even if I think I can, because it comes back to boot me. And we can talk about osteoporosis again, where this comes in, if we want, Daryl, because so many of our clients are in this space. But genetically, I can see that, and it changes the conversation immediately, whether the person likes it or not. That your genes don't lie. So,
no, exactly.
Go ahead.
So, I mean, we're talking about pain a little bit as well, and how the body compensates, and where the stress goes repeatedly. This is from a movement side again. So I try and look at sort of what's the body protecting or trying to avoid. It could be something as little as a knee injury, a tweak, or an ankle, like you say, which teaches the body to avoid that side while it's recovering, but it's never corrected. And whenever the body compensates to help you, which is a completely natural process, it's as natural as these high-rise buildings that are made to sway in a storm. If they didn't, they'd break. So it's important to be able to compensate away from an area that's busy being healed. But then if you develop slightly incorrect movement patterns from that process, especially when you're younger and you don't correct them, knowing also that the body usually overcompensates as a protective mechanism, which creates the need for another compensation further up the chain, it's quite difficult. So the idea that I'm trying to do is to try and look at the body mechanically and statically, to try and unravel what's happened. At the end of the day, it doesn't matter whether it was someone punched you in the nose or you torn a ligament. It still caused your body, and your nerves don't understand situations, they just feel. So what have they felt, and what are they doing to protect your body? And that becomes a warning signal. So we try and look at that to try and work out, I suppose, my version of the genomic. It's biomechanics, and
it is.
But not just biomechanics. It's physiological, biological, as well as behavioral science, and trying to work with all of those together to add to what I get from you and what you're doing with them as well. So yeah, how about when, again, we can tap into when people are feeling dismissed. Many people are told, and I've been, like, so many potential clients have come to me. I don't know why they've come to me. They've just been said, last resort, otherwise you're going to have surgery. Go and talk to this guy. We've heard it. And they sit down and I just talk to them and explain that exercise is not actually hectic. I've had people in their 90s that were told by their doctors not to squat anymore. So I said to the doctor, how's he going to get up off the toilet? How's he going to get into the car? That's mobility. And within a year and a half, this particular guy who was in his 90s, I had him lunging across his field, his garden, with no support, with no knee pain, no back pain. And if you can actually get those kind of results at the age of 90, it just shows. So yeah, when they're told they're aging and they should stop doing the activities they love, it's not good. So why can that be such a helpful message for someone who wants to stay active? What we're talking about, Amanda, what do you reckon?
Well, I think I was just kind of thinking through all the biochemistry as you were talking. What this all rolls up to is independence, right? And if you're not independent, you're isolated. Even if you're living with someone. And we know, because it came out of the UK and Australia, that we have an isolation problem. Even if we're living next door to people, if our mobility is taken away, but our laps look perfect, that is a person who's still going to be depressed.
Yeah.
Right. And I was thinking about what you were saying with pain, because depression is a pain. It's a physical pain. It's an emotional pain. But if someone's in pain because they can't move, the signals to the brain create stress. Some people can handle stress better than others, but most people can't. So stress, depending on what their genes look like, can cause more inflammation, and you get caught in, which then is a signal not to move, right? Because round and round and round we go. So I'm kind of thinking through a lot of different biochemistry here, but I'm thinking through can't move, causes stress. Depending on your genes, that can cause a lot of dopamine to build up. People who can't get rid of dopamine can have a lot of anxiety, a lot of sleep issues. That raises cortisol. Cortisol's fine if you want to run away from something. It is not fine if it's chronic, which is what our world is. High levels of cortisol will shut down the immune system. It'll shut down the regulating immune system and amp the pro-inflammatory immune system, which says is a pain signal. Yeah. So mobility to me is like when you're painting, you're setting up a painting, you've got the blank canvas and you're just going to prep the canvas. That is what mobility is to life. And it's why I go back and say we shouldn't be teaching people mobility in the 60s, 70s, and 80s. This is something that should be in, physical education, right? When we have toddlers or what have you. But, we're jumping in midlife, and mobility gives people their independence and their life back, but it requires them understanding how they're built, right? And you finding where the pressure points are, where the tweaks, where we're compensating. And like you said, why are you compensating? Where does that compensation come from? And some of it's biochemical, biological. Some of it's trauma, right? It's protective. As we see, Daryl, with our work, we have clients who are protecting something. So that's my long answer to you hearing me say, even in my life, what I've learned, that mobility is a gift that we have to nurture. And it should be the first question in a medical conversation too. So
yeah. I suppose I'm still carrying on about the genomics with you, and how some people can work out and feel exhausted for days. I actually have a few clients like that, so I've had to learn with to sort of step back, shorter sets. If they look like they need to rest, take a break. You are in charge. I'm not going to force you to do anything. There's no sort of hardcore program. I ask, how are you today? They tell me honestly, and we take it like that. I mean, they might even think that they're unfit and give up. What do you think can influence whether someone recovers well or feels completely drained after exercise?
I think that's where teamwork actually comes in. And it's also, from my side, teeing up for that client expectations, like what I can see genomically on what we need to work on first and how long that's going to take, I think is really, really important in the exercise piece. And so what we often see, and I'm not sure if I'm answering your question, but there's a lot in our world that is pushing people to exercise and move even through pain, because it's connected to longevity. It is like VO2 max, and exercise is just instrumental. We have the strongest science around movement, I feel. But there's a lot of pressure on people to go to the gym, to move, to exercise, to lift excess weight. See it a lot with women in midlife. They suddenly start putting on weight, so they work even harder. And they're actually doing even more damage. And that's causing the fatigue and the inflammation, depending on their genes. Then they have soft tissue injuries that we know takes so long to fix. Guilty. So a lot of it from my side is expectations, Daryl, on here's what I think is going on. Here's what we need to work on first, so that we optimize you versus you thinking you have to follow a protocol because you're not going to be 80 because you just watched an influencer say you got to do this many push-ups, press-ups, and you should all be able to hold a 5-minute plank. Come on.
That's true. Sometimes the smarter plan is the one that the body can actually recover from, and that's what you want. Is your exercise is actually damaging you in a little way, and then your body then needs to use the nutrition and lifestyle and sleep to recover, and that's how you get stronger. So if your exercise is too much for your body to recover from, you're basically breaking yourself down, even though you have the best intentions. So I suppose we could call it sort of a proactive version of longevity. Let's think of another question. So why is it useful to understand your biology before something becomes a bigger issue, do you think, Amanda?
Well, because, why do you need to understand your biology becomes an issue? I think if we could answer that question, we would have totally fit and healthy people, right? But I think, would be great. Genomics, and this is my space, right? This is where I work, and epigenetics allows us to understand how we're built in a way that we've never had before. So when you understand your biology, you understand how your body shows up in the world, you understand its strengths and weaknesses, you remove the guesswork, but you also know the how and the why. So you know, we like you said, if you exercise outside of what your body is capable of doing, which we can see in genomics, it's not all about measuring data. Okay, that's important, like for training and et cetera. And I'm not a performance athlete, so that part is important. But genomics tells us how far you can push, and why you push, and when you push, and why something may happen that says you might want to change direction. So it's not about a set plan that's been released by the American College of Sports Medicine, for example, critical, and they're studying genomics. This is N of 1, uniquely you. So, and it doesn't change. You know, your genes don't change. Environment does, your genes don't.
Yeah, yeah. I mean, from a movement point of view, we don't really want to help for a person to keep going and wait until they actually lose their confidence. So looking at building strength, mobility, and capacity before limitations take over. And this is, I think, where MobilitySpan becomes practical and quite obvious. Why don't we explain the two parts of mobility code clearly? As a biological architect, what are you looking for when you review someone's DNA and biological profile, Amanda?
What do I look for? Well, I have a unique way of working, and I train clinicians around the world in this space. And so we ask a different set of questions when I do, and I'm going to train my clinicians to work within the way they want to. But every person is a blank slate. So we don't know what we're going to see. But the most important questions we can ask someone is, what would they like answers to? You know, what is happening in their health history or their family history that they would like insights into when I'm looking at their DNA, which is a very different way of working. I'm looking for patterns based on the questions I'm being asked. And I'm going to see patterns beyond that, saying, you know what, which make me ask questions like, how are you sleeping? Or when you were running in college, were you injured a lot? You know, so I read the DNA from the perspective of what questions somebody has. Everyone has questions. They might be scared they're going to get Alzheimer's, comes up a lot. They're petrified. Or am I going to get heart disease because my father had a heart attack in his 40s? Can we see this? From my perspective, I'm coming in from that. So it's an empowerment. It's meeting the client where they're at, but I will pivot to other things I'm seeing in their DNA, which where the movement piece comes in as well. So I will automatically pivot to that. But I will also say, because it's important, push it over to you, because I want our listeners to know what we see and why we are doing my mobility code. Is I will have clients coming in and say, well, I'm perfectly healthy, but I've got real digestive issues. And oh, by the way, I've got a T-score of negative 3.8, but they think they're healthy. Is okay, wait a minute. And what are we doing about that? You know, that is not healthy. That is your body saying, can you find where something went wrong? And can you put me with a person who can correctly put the right mechanical load in my body, properly load my bones or my muscles, so my bones, you know, the signals get back to my bones. That's what I also see. So I never read DNA to say, oh, I'm going to find osteoporosis. No, I find things that lead to, this is the why, and this is where you need to be with the right person to kind of establish how your body was built. So yes, very differently, Daryl.
Yeah, so I think as the movement part, I'm obviously going to be looking at the genomics with you and taking advice from you about what you're doing, et cetera, et cetera. And I think people also feel much more understood and much more supported when we all work together and everyone knows what's happening and communicating. Obviously, I'll look after posture and alignment and mobility and all those kind of things. And I'm just really trying to understand how a person moves and where the stress is coming from and how it got there. Because people go and get treated and, you know, fantastic. I've had the best therapists in the world that really helped. But you go and carry on doing what you did to get there in the first place again. So going deeper than that. And if you could actually learn how to heal yourself or correct yourself movement-wise to become a prevention, with the genetic situation, it becomes a very potent situation. You know, And, you know, to see how the two pictures connect is something that's sort of where we could maybe move to now. So when biology and movement are looked at together, what do you reckon becomes clearer, Amanda?
I have a healthy, happy person becomes super, super clear.
Yes.
And that's it. But also this mobility piece, which I keep coming back to, is left off. And I think we have to be really clear about that we have people that I will send over to you who think they're doing the right thing. So I may be tweaking something cardiovascular, whatever it is, or digestively comes up over and over. But I know full well, because I'm asking them about their program, how are they moving, what are they doing, that if they keep going down that path, especially when we're looking at bone, skeletal, you know, posture, gait, etc., they're going to be back under the surgeon's knife again, because they think they're loading and doing all the right things. But in fact, what is happening in their movement style is re-engaging the biochemistry. The gut gets involved, the immune system's involved, then they lose their independence and mobility. And so a happy, healthy person to me, usually, no matter why they come and see me, is going to have at least one session with you, Daryl, because if they never know that they're moving, like they're slightly favoring their left hip or whatever, which happens all the time, or they're walking like duck feet or what have you, and they don't even know, their ability and their independence is going to be removed from them via surgery, maybe in their 70s or 60s. It's such a critical piece that hasn't been brought to their attention. People see people like you when they're injured, Daryl, and they shouldn't be. You know, they're now realizing that coming to you helps optimize 2 or 3 decades of their life, because we're nipping something that only an expert in the space can see.
Yeah. So it's kind of like, I suppose, a complete architectural audit.
It is.
So not just a DNA report, not just a movement assessment, bringing together biological and movement blueprints, and sort of helps to identify exactly what the body may need next, you know. So, and how would you explain the value of that to someone who feels overwhelmed by conflicting advice?
So, I mean, for me, I think the art of the work that we both do in our separate spaces is to figure out, as what I say in my space, so I'm going to give you a different word, where does someone get the best ROI? So where, if we tweak certain things, where did they get the best, in my space, return on ingestion? Because I'm working with food, right? That's most of where I'm working, because food is the greatest signal in the body. We can see it epigenetically and genetically. But for you, I think it's where did they get the best return on movement, ROM, right? Not REM, the band, but ROM.
Yes.
Because, as you said, these minor tweaks, when you're doing like a lunge, right? As you do, you put us all through it. You go at 12 o'clock straight ahead. But when you move the angle, so you can tweak something, right? So we know in our work, the tiniest tweak gives the best return on ingestion or best return on movement or mobility. And that's what we have to do with people who are overwhelmed. Like you said, come back and get an audit. So we're going to audit how you built biochemically and how you built structurally, and put that together, because you cannot argue with how you built. Can't. You cannot, you know, with your genetics or your musculature or your posture. You can't. We're unique. I'm built so differently from you or from Daniel. We're built completely differently. And so there is no one plan, even if you tweak it by 5%, that fits every human, because we're so diverse. Thank goodness. Yeah.
So you're getting clarity, no random information, no generic routines, which is an issue. And even the most advanced exercise coach these days will follow a certain system or a certain method, and it's not actually designed for humans. It's designed by humans. So I'm not using a method. I'm using what the body is designed for and trying to enhance that. And I think that's where these two work so well together. So a couple more questions, Amanda. What are some of the biggest aha moments that people have had when they understand their biological profile with you?
Aha moments, a lot of times that I'm seeing are cognitive in my work, because everything piles up to the brain in the end, right? That's how we experience the world. So when they realize one tweak can mean they can sleep, that's amazing. When they realize that a slight change in their diet, or maybe I'll add in a supplement that targets a very specific pathway in the body, and they can get off the couch in the afternoon because they feel motivated, that is an aha. That's when people say, I understand the power of how I'm built as a human, and that we can tweak things in you as a human once we find where the aperture is. And that's our work, Daryl, is where do you get the ROI? Where do you get the ROM to get somebody to feel like $1 million? Maybe the next day, maybe next week.
Yeah. I mean, from my side, the pain, stiffness, or lack of progress is not failure. It's just information. And the body's always giving clues, and we're trying to find them in ways that they may not have had before, to understand patterns and helping the body respond better. So, a couple more questions, maybe the last one. If someone's listening and they recognize themselves in one of these profiles, what would you want them to know?
There's a whole world out there that has probably opened up through genomics, that is now talking to, I guess, physical medicine or physical science, which is where you're working in ways. So there's new conversations out there that are available to you, that are not necessarily in the channels you've been, you used to. Like, we don't know if anyone else is combining DNA with rehabilitation or movement medicine, right? We just don't. And so just know that if it hasn't worked, even with the best trainers, the best PTs, and they're very, very good ones out there, it's not because they failed. It's just they just don't have the right combination for you. And like I said, in genomics, with motility, mobility, these pieces have not been tied together, and they've come out of us working deeply in our spaces, movement spaces, in this clinical space, to say, where do these people go? Aha. So if you found you just can't get out of the pain, or you just can't fix or strengthen this torn bicep for whatever reason, we're looking at the wrong thing. That we're looking at the wrong information in the body, and there are trained minds who can look at the right pieces to find the right conversation for your body. So, and they need to. You deserve it. It is available.
So I suppose we could say my mobility code was created to help people understand their body more clearly. And I suppose we've discussed Healthspan, and the future of longevity, which was Healthspan, can now be seen a bit more like something called MobilitySpan, which is quite a thing. I mean, we've had quite a deep chat tonight, and I thank you, Amanda, for your time. I also feel like I managed to run my first ever webinar reasonably successfully, so I can relax after this. I feel it's been very good. But yeah, it's probably time to wrap up and say thank you, everyone, for joining. Just to let you know that you're all invited to take the next step or book a consultation, and we'll put a slide up where the information's up. Thank you very much for attending. It's been really good and challenging for my brain as well. But I hope you all take care, and see you all around. Thank you, Amanda.
Thank you, Daryl. Great conversation.
Yes.